Hi, I'm Andrew Iraqi, physical therapist at Superior Physical Therapy, and we are the tennis elbow experts. I'm here today to teach you a 30-second self-test for you to perform to determine whether or not you have tennis elbow. You're probably wondering, where is my tennis elbow coming from? And I'm also here to talk to you about that as well. So please enjoy our 30-second self-test.
The number one condition here, this picture shows an animation of golfer's elbow or medial epicondylitis. This would be pain on the inside of the elbow, and commonly you can press on the area with your fingers and recreate the pain. Ultimately, you've got these three muscles here. The wrist flexors become overused and the tendons become irritated and inflamed, which can be a very painful condition. The second image here shows on the outside of the elbow, very similar issue. You've got the wrist extensors that the origin, the tendon, starts to get irritated and inflamed as well. All of these issues are essentially overuse issues that make us realize that the other parts of the body that are helping the elbow muscles and tendons out are not working properly, therefore need to be identified in order to take relief and stress off of the elbow.
Here's a 30-second self-test for elbow pain. One of the most common reasons we see people for elbow pain is a condition called tennis elbow, where the wrist extensors here in the forearm get inflamed and they get tendonitis from overuse. An easy way to test this area, the first easy way, is to just push along the outside of the elbow. If you feel pain when you push on that, there's a good chance that you have tennis elbow. Another way to do this would be to have my arm out straight, bring my wrist down and rotate it to the right. When I do that motion, if I have pain in the forearm here, again, that's a really strong indicator that I have what's called tennis elbow. Another not so common condition in the elbow is called golfer's elbow, which is where the wrist flexors on the inside of the wrist become painful. If I take my thumb and push on the inside of the elbow and there's pain there, there's a good chance that you may have golfer's elbow, both of which can be treated by physical therapy. Now that you've taken your 30-second self-test for tennis elbow and you've determined that you do indeed have tennis elbow, it's important to realize that tennis elbow can be caused by many parts of the body not moving correctly. We are the specialists in treating tennis elbow, and it's very important for the physical therapist here to look at you, determine where the source of your problem or source of your pain is coming from, and then give you prescriptive exercises. So if you're ready to take that next step and find a permanent solution for your pain, please give us a call today, 944-6541. If you're not ready to take that next step, we understand. That's why we've created resources on our website, such as the top 3 exercises for tennis elbow that help somebody in your situation that may have the most common sources of tennis elbow begin to work on those sources of the tennis elbow. So keep in mind, those are for the common reasons why someone has tennis elbow. And if they don't help you, I would encourage you to seek out help from a physical therapist here at Superior Physical Therapy. And we're here to help you. There's no reason you should have to live with pain, and it's not going to get better on its own. So please take that next step and reach out to us today. Again, our number is 944-6541. Thank you for watching.